Multiple myeloma is a malignant plasma cell disorder. It's usually characterized by an over-proliferation of malignant plasma cells in the bone marrow, along with low blood counts. Usually anemia is one of the first signs associated with fatigue. Patients can present with renal insufficiency or kidney problems. And they may also have bone pain or bone fractures as part of their presentation. Cytogenetic testing is very important to prognosticate and divide patients into risk categories. There are certain subsets of patients who have no cytogenetic abnormality or certain favorable cytogenetic abnormalities which portends good prognosis. There are certain cytogenetic abnormalities that portend poor prognosis, and then there are others that are kind of in between. So currently the International Myeloma Working Group, which I'm a part of, divides patients into three categories, which are good, intermediate, and high-risk patients, based on cytogenetic profiling, along with certain other features of disease burden, such as the ISS staging. The risk stratification in myeloma is very important for making treatment decisions, perhaps not as pervasive in clinical practice right now, but very important over the next 5 years. So the good or intermediate risk patients may be treated more through a standard of care mechanisms and may be followed a little differently compared to the high risk patients, who a lot of physicians may feel may need to be treated with more aggressive approaches and may need to be followed more closely. And those patients may then qualify for certain clinical trials as well. So it's an extremely important way of knowing which patients are going to do good and which patients may be doing poorly in spite of all our good efforts. So cytogenetics have been done in myeloma in several different ways. Traditionally, the conventional cytogenetics rely on looking at specific metaphase abnormalities by virtue of putting some cells in a test tube, giving some specific growth factors to push cells towards mitosis, because that's the only way that you can see the chromosomes clearly. In about the last 20 years, fluorescent in situ hybridization can better identify specific abnormalities, and that's the more recent technology that has been utilized to look at specific abnormalities. The challenges with both these techniques are that you only have a small number of probes to identify certain abnormalities, and with cytogenetics, conventional cytogenetics, you're only relying on the cells that are dividing, and that may not give you the complete picture. The MMprofiler provides several advantages to the current way of looking at conventional cytogenetics in fish. It provides a more global picture of what's going on in all the malignant plasma cells taken from a given patient, because you're looking at global gene expression profiling patterns, and you're looking at all the 30,000 genes that are present in a human cell. The MMprofiler is done on an Affymetrix platform which has 54,000 probes. So there are certain probes that are redundant for certain genes, but it really gives you a very global snapshot of what's going on in a newly diagnosed patient. And one can utilize that information not just to risk stratify, but also to potentially be predictive for certain responses to certain therapies. The MMprofiler currently utilizes a 92 gene signature called the SkylineDx, which is based on the HOVON database from their pivotal clinical trial, which was done in a large cohort of newly diagnosed myeloma patients. It has also been validated in several other data sets, including the Arkansas Total Therapy data sets and the ECOG data sets on the Revlimid low versus high dexamethasone clinical trial. And what we found is that the SkylineDx identifies about 15% high-risk newly diagnosed myeloma patients who will do poorly in these data sets regardless of the upfront therapy rendered. So that kind of prognostic information is extremely important in trying to identify those high-risk patients. So essentially what the SKY92 gene signature is doing is identifying patients who will do well, so they may be called standard or good risk, and patients who will do poorly in terms of their progression-free and overall survival, deemed as high-risk patients. The MMprofiler will be available for clinical use from early 2015, perhaps more widely applicable use by the summer of 2015. SkylineDx plans to provide this service to clinicians who may be sending samples in through the early part of 2015, but I feel that the broader usage will likely be implemented from the summer of 2015 onwards. The field of myeloma, multiple myeloma, diagnostics, therapeutics, novel drug development, and the strategies that we're utilizing for therapeutics has significantly changed in the last 10 years. There are several new novel mechanisms of actions and drug classes under development. I think this is a huge opportunity to not just appreciate the fact that myeloma is not just, it's not multiple myeloma, but multiple myeloma. So it's a heterogeneous group of diseases. There will be subsets of diseases that we can recognize using gene expression profiling tools like the MMprofiler, and then choose or develop therapies for those subsets of patients that are unique to that group alone. I think that is the major advance that I'm looking forward to. I'm also looking forward to using tools like the MMprofiler gene expression profiling to identify patients who may benefit from one drug or drug combination versus the other. It is challenging perhaps, but certainly something that we need to be engaged in. Currently, the myeloma treatment landscape is very agnostic. We approach myeloma in big umbrellas, so we have the standard, intermediate, and high risk, but perhaps myeloma is more heterogeneous than that. So it's like teasing hairs, but I think it's extremely important from the patient's perspective to identify subgroups who are benefiting from certain therapies, and perhaps the patients that we feel may need more aggressive therapy may not need more aggressive therapy and may well do very well with novel agents by themselves. So all these questions are extremely important. I think that gene expression profiling platforms like the MMprofiler will be very important in reaching and achieving that goal.